total number of deaths so far across the UK is 103,126. Half those people have died since the start of November. The UK's mass vaccinations programme continues, though it appears to have slowed somewhat in the past week. 282,812 people have had their first dose of one of the 3 approved Covid-19 vaccines in the latest 24-hour period, taking the overall number of people who've had their first jab to more than 7.4 million. The government is being urged to do all it can to encourage people from minority ethnic backgrounds to have a Covid vaccination. Some research seems to indicate that many black people are particularly hesitant about having the jab because they don't trust the vaccination programme. Our community affairs correspondent Adina Campbell has been speaking to some people who are trying to change perceptions.
Working as a scientist couldn't get any better than this for Mustafa Bitey. His work on the Oxford AstraZeneca vaccine has been the highlight of his career so far. But away from the lab, and as someone who grew up in the Gambia, he's urging other members of the black community to have a Covid vaccine.
If somebody is sick and they go to the hospital to get treatment, obviously they don't go to a friend or somebody who is not a doctor for their diagnosis. They rely on a doctor to diagnose them. So the same way you rely on a doctor for information about your ailment is the same way you should rely on the experts in the field who are involved in this work.
Concerns have been growing for weeks over the number of people from ethnic minority groups who are reluctant about the vaccines. A study published yesterday suggested older black people are much less likely to have been vaccinated than older white people. And today, the government has published more figures on ethnicity, but more information is needed to understand the numbers. This social media video, put together by doctors, faith leaders and community workers, is one way they're hoping to spread accurate information about Covid vaccines.
Trust is a big issue here, isn't it? That comes into play when people think about, how the vaccine could potentially affect them.
It does, and I think we have to be honest and we have to be open-minded and understand that historically, definitely within the black community and history has damaged us consciously and unconsciously.
It's an ethical responsibility as well as a faith responsibility to take information from reliable sources and to count that as your evidence as opposed to anything else.
Why was it important for all of you to be part of making this social media video that you've decided to share?
Firstly, it's to really raise awareness about vaccination in our community and making the information available to people in an accessible format. We also overcame language barriers by making sure the information is accessible in many languages.
And for those in high-risk groups over the age of 80 who've had a vaccine, the message is clear.
I'm very, very hopeful that people will take it because you may say, no, I'm all right, but you may infect the others. So where do you go? So this is the problem. You should all be in it together.
Adina Campbell, BBC News.